Captain Marcus Webb had been unconscious for 11 minutes. His arm was dying. The surgeons had accepted it. The room was calm in the way rooms get when everyone inside has already agreed on the outcome. Then the door opened. A nurse walked in. Quiet, unhurried, nobody looked up. She moved to the supply cart with the kind of stillness that doesn't draw attention. She was nobody. And then Captain Marcus Webb opened his eyes. He didn't look at the surgeons. He didn't look at the monitors or the instruments lined up beside him like a decision already made. He looked at her, and with his good arm, slowly and deliberately, he raised his hand and saluted her. Nobody spoke, because a dying man had just looked past every qualified surgeon in the room and saluted a nurse nobody had ever seen before. And when she turned around, there was a scar on her forearm that made the lead surgeon take one step backward without knowing why. He thought he was looking at a stranger. He was looking at a ghost. This is the story of the scar that changed everything. Mercy General didn't sleep. It slowed down after midnight, the way a river slows in winter. Still moving, still dangerous, just quieter about it. The trauma wing on the 3rd floor ran on fluorescent light and controlled urgency, a place where people arrived broken and left either rebuilt or not at all. Room 6 had been busy since 6:43 that evening. Captain Marcus Webb had come in by ambulance. No sirens, which somehow made it worse. Sirens meant fight. No sirens meant the people transporting him had already started doing the math. He was 39 years old, built like something that had been tested repeatedly and hadn't broken yet, with a service record that the paramedics weren't cleared to read, and a left arm that was a different story entirely. Crush injury, vascular compromise, blood flow interrupted at the brachial artery during a training exercise that nobody in the room had been given details about, and nobody had asked for. The lead surgeon, Dr. Philip Hart, had reviewed the imaging, reviewed the vitals, and made his determination with the efficiency of a man who had made similar determinations many times before. The arm was not salvageable. Amputation at the mid-humerus, scheduled for 10:15. Clean, necessary, final. The resident on duty, a young man named Dr. Ellis, who was 3 months into his surgical rotation and still flinched at certain sounds, had laid the instruments out in precise order and was now standing near the door, trying to look useful. The room was settled into its quiet, resigned rhythm. Then the charge nurse appeared in the doorway. Her name was Rita, and she had the particular energy of someone managing 4 problems simultaneously while appearing to manage none. She stepped inside, checked the monitor readings, and glanced at Dr. Hart. "We have a new nurse starting tonight, 3rd shift. I'm going to send her in to prep the secondary line before you begin." Hart didn't look up from the chart. "Fine." A minute passed. The door opened again. She came in the way weather comes in, not dramatically, just present, suddenly, where she hadn't been before. She was slight, dark-haired, with the kind of face that didn't announce itself. Her scrubs were clean and slightly too large, the universal marker of someone borrowing a uniform on their first night. She carried herself with a quietness that read, to everyone in that room, as uncertainty. New nurse. Nobody looked twice. Her name badge read, N. Calloway, RN. She moved to the supply cart near the window and began organizing the secondary medication line with her back to the room. Her movements were efficient without being remarkable. She didn't introduce herself. She just worked. Dr. Ellis watched her for a moment the way young residents watch new nurses, assessing, categorizing, dismissing. She looked young. She looked inexperienced. He went back to his instruments. Dr. Hart checked the time. 10 minutes to procedure. Let's get the patient's sedation confirmed. The monitor beside Captain Webb beeped steadily. He had been under for 12 minutes now. His pressure was low but holding. His arm, wrapped in temporary compression below the elbow, was already a shade that suggested the conversation between tissue and blood supply was coming to an end. Nobody was watching him closely when it happened. His eyelids moved. Then they opened. Not the confused, swimming half-consciousness of someone fighting sedation. Full, direct, deliberate. His eyes opened and moved immediately. Not to the ceiling, not to the surgeons, not to the instruments lined up beside him like an argument he had already lost. They moved to her, across the room, to the nurse at the supply cart with her back to him. He stared at her for 3 full seconds. Then Captain Marcus Webb, with his good arm, raised his hand slowly to his forehead. The salute was perfect, unhurried, deeply intentional, the kind of salute that carries meaning the way very few gestures carry meaning, not as ceremony, but as recognition, as debt. Dr. Ellis saw it first. His mouth opened. Hart looked up. The room became the specific kind of silent that happens when something occurs that has no immediate explanation. The nurse at the supply cart went very still. She didn't turn around right away. When she did, her face was composed, unreadable, the mask of someone who had spent a long time learning to control what their expression gave away. But her eyes told a different story. She looked at Captain Webb the way a person looks at something they buried a long time ago and never expected to see standing in front of them again. Dr. Hart set down the chart. He looked between the captain and the nurse. His eyes dropped, without knowing exactly why, to her forearm. Her sleeve had shifted when she turned. On the inside of her left forearm was a scar. It wasn't surgical. It wasn't accidental. It was precise and deliberate. A thin raised line curved at both ends in a shape that meant nothing to anyone in that room. Except it meant something to Dr. Hart, because Captain Webb had the same scar, in the same place. He had noticed it during intake and thought nothing of it. An old injury. Coincidence. Now he wasn't sure it was either of those things. "Who are you?" Dr. Hart said. His voice came out quieter than he intended. The nurse looked at him, then at Captain Webb, then back at Hart. Her jaw tightened slightly. "Nora Calloway," she said. "Night shift." Dr. Hart looked at the scar, then at her face. "That's not what I mean," he said. The room waited. Captain Webb's hand was still raised. The silence in room 6 had weight. Dr. Hart was still looking at her forearm. Dr. Ellis was looking at Dr. Hart. Captain Webb's hand was still raised, trembling slightly from the effort of holding a salute, through sedation and blood loss, and a body that was quietly shutting down one system at a time. Nora Calloway looked at none of them. She looked only at Webb. "Put your arm down, Captain," she said quietly. "You'll tear the IV line." His hand lowered, slowly, like a flag at the end of something. Dr. Hart stepped forward. "Miss Calloway, that scar on your forearm." She pulled her sleeve down in one clean motion. "Old injury," she said. "It's nothing." "It's not nothing," Webb said. His voice was rough, scraped thin by sedation and pain, but the certainty in it was absolute. He was looking at her with the focused intensity of a man using everything he had left just to stay present in the room. He said her name, the way you say a word you thought you'd forgotten, and suddenly find sitting perfectly intact in the back of your memory. Nora Calloway, Ghost 6. Her jaw tightened. "Don't," she said. The young resident looked between them. "Ghost 6? Webb ignored him. His eyes stayed fixed on her. "Kunar Province, March 2017. Operation Black Wall. You were the forward surgical attachment. You and your team came in when the medevacs couldn't reach us." His breathing was labored but deliberate. "You were there when the ridge collapsed." Dr. Hart held up a hand. "Captain, you need to conserve your strength. We have a procedure scheduled in 8 minutes and—" "His arm," Nora said suddenly. Everyone looked at her. She was looking at Webb's left arm, not at his face, not at the surgeons, at the arm. Her eyes moved along it the way someone reads something written in a language only they understand. She set down the medication tray and walked toward the bed. "Miss Calloway," Dr. Hart said sharply, "you are not cleared to—" She ignored him completely. She reached Webb's bedside, and without asking permission, she placed her fingers along the upper arm, pressing gently at specific points, her eyes tracking something invisible to everyone else in the room. Her touch was practiced and precise in a way that had nothing to do with nursing school. Webb watched her face. Some of the tension left his jaw. "Tell me what you feel," she said to him quietly. "Pressure," he said, "like something's locked. No pain below the elbow anymore, just nothing." She nodded slowly. "When did the nothing start?" "About an hour ago." She pressed 2 fingers to his wrist, then lower, just below the compression wrap. She held them there for 15 seconds, perfectly still, counting something internally. "I need you to step away from my patient, right now." Nora looked up at him. "When did you last check his distal pulse?" Hart stopped. "What?" "Distal pulse, below the injury. When did you last check it?" Hart glanced at the resident. Ellis swallowed. "We checked on intake." "That was 2 hours ago," Nora said. She looked back at Webb's arm. "The compression wrap has shifted. The pressure is tracking wrong." She stood up straight. "This isn't vascular collapse from the crush injury. It's compartment syndrome layered over a brachial spasm. The blood vessel isn't severed. It's locked." Dr. Hart crossed his arms. "And you determined this how, exactly?" "By checking," she said evenly. The word landed in the room like something dropped from a height. Ellis looked at Hart. Hart looked at Nora. The monitor beeped steadily, indifferently, marking time. "You're a nurse," Hart said. His voice had shifted into something harder. "A new nurse on her first shift. You walked into this room 20 minutes ago, and now you're telling me my diagnosis is wrong?" "I'm telling you his arm can be saved," Nora said. She didn't raise her voice. She didn't need to. "If you amputate tonight, you will be removing a limb that had a viable blood supply." She looked at him steadily. "I've seen this presentation twice, both times in the field. Both times the initial assessment called for amputation. Both times the arm was saved." Hart laughed. It was a short, disbelieving sound. "In the field. You're a nurse. What field?" She said nothing. Webb spoke instead. His voice was quieter now, the sedation pulling harder. "Kunar Province," he said again. "Operation Blackwall." He looked at Hart with the exhausted certainty of a man spending his last reserves on something that matters. She performed 2 surgical decompressions in the back of a burning vehicle during an active firefight. If she says the arm can be saved, the arm can be saved. The room was quiet again. Dr. Ellis was staring at Nora with an expression that had moved well past confusion into something approaching awe. Hart looked at her for a long moment. His eyes dropped once more to her forearm, to the line of the scar beneath her sleeve. "Operation Blackwall was classified," he said slowly. "Fully classified. The surgical team attached to that unit was listed as—" He stopped. Something shifted in his face. He looked at her name badge, then at her face, then at the scar. "The team was listed as KIA," he said. "Every member." Nora held his gaze. "Every member," she said quietly. "Yes." The monitor beeped. Webb's fingers moved slightly on the bed. A small, deliberate movement, reaching toward nothing, or toward something only he could see. Dr. Ellis whispered, almost to himself, "She's dead." Nora turned back to Webb's arm. "Do you want to keep arguing?" she said to Hart. "Or do you want to save his arm?" Dr. Hart didn't move for a long moment. He stood in the center of room 6, looking at a woman who was officially dead, who had just told him his diagnosis was wrong, who was standing at the bedside of a Navy SEAL captain, who had saluted her through sedation and blood loss, like she was the only real thing in the room. He was a surgeon. He dealt in certainties, imaging, numbers, outcomes. None of what was happening in front of him fit any category he had. "Fine," he said finally. His voice was clipped, controlled, the voice of a man making a calculated decision he wasn't entirely comfortable with. "You have 10 minutes to show me what you're seeing. If I'm not convinced, we proceed with the amputation as scheduled. And after this is over, you and I are going to have a very serious conversation about who you actually are." Nora was already moving. She reached for the supply cart, selected instruments with the efficiency of someone who knew exactly what she needed before her hand arrived, and returned to Webb's bedside. She began unwrapping the compression with careful, deliberate hands. Dr. Ellis drifted closer despite himself. He watched her fingers move along the arm, pressing, mapping, reading the tissue the way a doctor reads an image. "How do you know where to press?" he asked quietly. "You feel for resistance," she said. "Compartment syndrome creates a hardness that doesn't belong." She guided his fingers gently to a point on Webb's upper arm. "There. Feel that." Ellis pressed. His eyes widened slightly. "It's like pressing against a wall." "Because the pressure has nowhere to go," Nora said. "The blood is backed up behind it. The vessel isn't gone. It's waiting." Hart moved closer. He pressed his own fingers to the point she indicated. He said nothing. But something in his posture shifted by a degree. Webb's eyes opened again. Halfway. Enough. He looked at Nora. His lips moved. She leaned closer. "Rook," he whispered. Her hand stilled for just a fraction of a second. "Rook is gone," she said quietly. "Keep still." He shook his head slightly. "Not gone. He found you. Said you were here. Said—" His eyes closed again, the sedation pulling him back under. Nora stood up straight. She breathed in through her nose and out slowly through her mouth. A controlled reset. The kind of breathing that doesn't come from yoga or therapy, but from years of needing to function in conditions designed to make functioning impossible. Dr. Ellis watched her. "Who is Rook?" he asked. Nobody answered him. Kunar Province, Afghanistan. March 2017. The ridgeline was on fire. Not metaphorically. The eastern face of the Korangal Spur had been burning for 40 minutes, fed by a ruptured fuel line from the second vehicle in the convoy, and accelerated by winds that came down off the Hindu Kush, like they had somewhere to be. Nora had been working for 31 minutes without stopping. She was on her third patient. The forward surgical kit was open on the ground beside her, instruments laid out on a trauma blanket that had stopped being sterile approximately 25 minutes ago. She had stopped thinking about sterile. She was thinking about the next 10 seconds, and nothing beyond that. Her partner, a combat medic named Daniel Rook, was working 6 feet away on another casualty. They had been partners for 2 years. They worked without speaking, without signaling, a system so practiced it had become instinct. Captain Webb had come in fourth. He was conscious when they brought him, which was either good or bad, depending on what was wrong with him. Chest plate cracked, possible rib fractures, left arm caught under the vehicle when it rolled. He was looking at the sky when Nora reached him. His lips were moving. "Stay with me," she had said. She didn't know his name yet. "I'm with you," he had said. His voice was surprisingly steady for a man with a collapsed lung. She worked on his arm first, because the arm was losing the argument with time faster than anything else. She found the locked vessel. She felt the backed-up pressure behind the crush injury. She had seen it once before, 6 months earlier, and she knew what it needed. She performed the decompression in 4 minutes and 30 seconds. Webb's color came back. He grabbed her wrist. "You're good at this," he said. "I've had practice," she replied. He almost smiled. Then the secondary explosion hit the ridgeline. The pressure wave came first, a wall of displaced air that knocked her sideways off her knees. She hit the ground and stayed there, instinct flattening her before her brain caught up. When she lifted her head, the world had rearranged itself. Rook was down. Not working. Down. She crawled to him. She already knew before she reached him. She knew the way you know things you don't want to know. The knowledge arriving before the evidence, settling into your chest like something heavy and permanent. She worked on him anyway. She worked on him for 6 minutes. It didn't matter. The QRF arrived 14 minutes later. They found her still beside him, her hands still pressing, still refusing the outcome her training told her had already been determined. They had to pull her away. 3 days later, she received word that the official after-action report had listed the entire forward surgical team as killed in action. Communications failure, they said. Records lost in the subsequent engagement. She knew what it really meant. Classified operation, classified casualties, erased cleanly and completely by people sitting in buildings far away from burning ridgelines. Correct the record and spend the next several years fighting a bureaucracy designed to exhaust people into silence or disappear. She disappeared. She became Nora Calloway. She became a nurse. She told herself it was enough. Present day. Room 6. Nora came back to the room the way you surface from deep water, all at once, with the sensation of pressure releasing. Dr. Hart was watching her. "You went somewhere," he said. It wasn't accusatory. It was observational, almost careful. She picked up her instruments. "I'm back," she said. He was quiet for a moment. Then, Operation Blackwall. I was on the oversight committee. I reviewed the after-action report 18 months later when the classification level dropped. He paused. The surgical team's KIA listing always seemed wrong to me. The details didn't align. Nora kept her eyes on Webb's arm. "Details rarely do," she said. Hart looked at her for a long moment. "Why did you come back?" he asked. "You disappeared completely. You built a new life. Why walk into a hospital? Why take a nursing position? Why risk being recognized?" Nora was quiet. Then she said, "Because staying disappeared felt too much like letting them win." She looked at Webb's face, at the steadiness of his breathing. "And because people keep needing saving," she said, "and I keep knowing how." Hart picked up his chart. He looked at the amputation schedule. He looked at Webb's arm. He looked at Nora. "Show me the decompression," he said quietly. "Walk me through every step. If it holds up, I'll assist you myself." Nora looked at him. Something in her face shifted. Not surprise exactly, something quieter than that. She nodded. She turned back to the arm. She began. The decompression took 9 minutes. Nora worked. Hart watched. Ellis handed instruments without being asked, falling into her rhythm, the way people fall into the rhythm of someone who knows exactly what they are doing. Nobody spoke unnecessarily. The first incision was clean, precise, a line so controlled that Hart leaned forward slightly without realizing it. The second released the pressure. The sound was almost nothing, a soft give, like a held breath finally released, but the effect was immediate. Color moved down Webb's arm like dawn moving across a landscape. Slow, then faster, pink returning to white skin, warmth following behind it. Ellis whispered something under his breath. Nora checked the distal pulse, pressed 2 fingers below the wrist, counted. "It's there," she said. "Strong." Hart pressed his own fingers beside hers. He was quiet for a moment. Then he said simply and without qualification, "You were right." Nora was already closing. She sutured with the speed of someone for whom speed had never been optional. Clean passes, tight, economical, no wasted movement. Webb's monitor beeped steadily. His pressure was climbing back towards something sustainable. His color was returning. His arm, which 40 minutes ago had been 40 minutes from gone, was alive. Nora stepped back. She stripped her gloves. She set them on the tray. She allowed herself one breath that was slightly longer than the others. Hart looked at her. "We need to talk about next steps, about your records, about—" The monitor screamed. Not the steady, urgent rhythm of an alarm, a single flat tone, unbroken, the sound that has only one meaning. Flatline. Ellis spun. Hart moved. The room shifted from still to chaotic in the space between one heartbeat and the absence of the next. "He's in arrest," Ellis shouted. "VFib. No output." Hart reached for the crash cart. "Charging. Stand clear." Nora was already at Webb's side. She had 2 fingers on his neck, his chest, reading him the way she had read him for 9 minutes, with her eyes closed and her hands open. "Something's wrong with the pad placement," she said. Hart looked up. "What?" She looked at the defibrillator pads. "The anterior pad is too high. It's not capturing the full ventricle." She reached for it. "Don't touch that," Hart snapped. "You are not a—" "He's going to die," Nora said. "Right now. In the next 90 seconds. She looked at Hart. "Move." Hart hesitated. 1 second, 2. "Move," she said again. "Quiet. Absolute." He moved. Nora repositioned the anterior pad. 2 inches lower. Angled slightly. A placement no standard training manual described, because it came from a different kind of training entirely. "Charge it." Ellis charged it. "Clear," Nora said. The shock fired. Webb's body arched, settled. The monitors stayed flat. "Again," Nora said immediately. Ellis looked at Hart. Hart nodded. "Again," Ellis said. "Charging. Clear." Second shock. Webb arched, settled. The monitors stayed flat. The room was the particular silence of people watching something fail. Ellis swallowed. "We should call—" "No," Nora said. She reached under the bed rail. She lifted Webb's right arm slightly, rotating the shoulder. A small adjustment, invisible to anyone who didn't know what it was changing. It was changing the electrical pathway through the chest wall. It was something she had learned not in a classroom, but on a dirt floor in Kunar province, with a headlamp and no backup, and a man who had 30 seconds left. "Charge it again," she said. Ellis charged it. Nora leaned close to Webb's face. Her voice dropped to almost nothing. "Don't you do this," she said. "Not here. Not after everything." She pressed her hand flat against his sternum for 1 second. "You came back for a reason, Marcus. Stay." "Clear," she said. Third shock. Webb arched. Then, a flicker. One blip on the monitor. Fragile. Barely there. The electrical equivalent of a match struck in wind. Then another. Then a rhythm. Weak. Unsteady. But there. Unmistakably, stubbornly, improbably there. The room exhaled as one. Ellis grabbed the rail. His hands were shaking. "How did you— the pad placement, how did you know that would—" Nora stepped back. Her hands were trembling. She pressed them flat against her thighs, so nobody would see. "I've done it before," she said. Her voice was barely sound. Hart stared at her. He looked like a man revising something fundamental. Webb's eyes opened. Slow, unfocused. Then, finding her. The way they had found her across the room an hour ago. Like she was the fixed point everything else oriented around. His lips moved. She leaned in. "Ghost 6, he whispered. She closed her eyes for 1 second. "I'm here," she said. "You're stable. Stop talking." His mouth curved slightly. The ghost of something that wasn't quite a smile, but was trying to be. "Knew you were," he breathed. "Never really gone." Nora straightened up. She turned toward the wall. She pressed the back of her hand against her mouth for exactly 2 seconds. Then she turned back around. She was composed, steady, the mask back in place. Dr. Hart was watching her with an expression that had moved entirely beyond the professional into something more honest and more human. "You just saved his life twice in 1 hour," he said quietly, at the rhythm climbing steadily towards something that looked like survival. "It's what I do," she said. The night shift settled into its quieter rhythm. The crash cart was wheeled back to its corner. The instruments were cleared. The monitors beeped with the steady, unhurried confidence of a man whose body had decided to keep going, despite considerable evidence that it shouldn't. Nora stood at the window of room 6, writing her notes. Her handwriting was small and precise. She wrote the way she did everything, completely, without leaving anything out. Dr. Ellis had not stopped looking at her since the flatline. He stood near the door, with the expression of someone who had attended a lecture expecting one thing and received something else entirely. Something that rearranged the furniture of what he thought he understood. Dr. Hart had made 3 phone calls in the hallway. Nora hadn't asked who to. She had a reasonable idea. Webb was sleeping. The deep, surrendered unconsciousness of a body that had fought hard and been given permission to stop fighting temporarily. His arm lay beside him, wrapped in clean dressing, viable, warm, attached. The door opened. Hart came back in. He stood beside Nora at the window. He looked at her notes. He looked at her face. "The calls I made," he said quietly. "The first was to the chief of surgery. The second was to the hospital administrator." He paused. "The third was to a contact I have at the Department of Defense, Veterans Affairs Oversight Division." Nora kept writing. "And," she said. Hart was quiet for a moment. "The KIA listing for Operation Blackwall's forward surgical team was a deliberate administrative decision," he said, "made by 2 people who are no longer in their positions." He looked at her. "It can be corrected. It should be corrected. If you want it to be." Nora's pen stopped moving. She stood very still. "What does correction look like?" she asked. "Your service record reinstated," Hart said. "Your decorations. There were several, apparently. Your real name on the right documents." He paused carefully. "And a formal acknowledgement that what was done to you and your team was wrong." Nora looked at the window, at the dark glass and the city lights beyond it, and her own reflection looking back at her, a woman in scrubs slightly too large, holding a pen, and standing in a hospital room at 11:40 at night. She had spent 7 years building Nora Calloway, 7 years of quiet shifts and kept sleeves, and a name that fit like a borrowed coat. 7 years of saving people in a room instead of a field, and telling herself the distance was protection. She thought about Rook. She thought about the ridgeline. She thought about Webb's hand raised in a salute, through sedation and blood loss and 11 minutes of darkness, finding her across a room full of people who didn't know her name. She thought about what Hart had just said. Your decorations. There were several, apparently. She almost smiled. "What happens to Nora Calloway?" she asked. Hart considered it. "She retires," he said. "Or she stays." He looked at her steadily. "We have a trauma wing that could use someone who knows what they're doing." He glanced at the crash cart in the corner. "Considerably." Nora looked at Webb sleeping. His arm rose and fell with his breathing, slow and even, alive. She thought about what it had cost to disappear, and what it had cost to stay disappeared, and whether those 2 costs had ever actually balanced each other out, or whether she had simply been paying the same debt twice in different currencies. She set her pen down. She rolled up her left sleeve. She looked at the scar. The thin raised line curved at both ends, the mark she shared with a man sleeping 6 feet away. the mark that had pulled her back into a room she hadn't planned to enter, and a life she hadn't planned to reclaim. She ran her thumb across it slowly. Then she rolled her sleeve back down. She picked up her pen. She crossed out Nora Calloway at the top of the notes page. She wrote 2 words instead, her real name. She set the pen down and looked at Hart. "Let's talk about that trauma position," she said. Webb was discharged on a Thursday morning 3 weeks later. He walked out on his own, both arms intact. He stood in the entrance of Mercy General in the pale autumn sunlight and looked back at the building the way soldiers look at terrain they have crossed, with respect and relief and the particular gratitude of someone who understands what the alternative was. She was standing at the top of the steps, not in scrubs, in her own clothes, a jacket, her hair down. She looked different without the uniform and the borrowed name and the kept sleeve. She looked, Webb thought, like someone who had recently put something down that they had been carrying for a very long time. He walked up the steps. He stopped in front of her. He raised his left arm slowly, the arm she had saved, the arm that had been 40 minutes from gone on a Wednesday night, when she walked into a room nobody expected her to walk into. He saluted her. Precise, deliberate, the same salute he had given her from a hospital bed, through sedation and blood loss. The same salute he had given her on a burning ridgeline in Kunar province, when she had pressed her hands against his arm and refused the outcome. She looked at him for a long moment. Then she raised her own hand, and for the first time in 7 years, she returned it. They stood there on the steps of Mercy General in the pale autumn light. 2 people who had found each other twice in the worst possible circumstances and were now, finally, standing somewhere that wasn't on fire. "To Rook," Webb said quietly. "To Rook," she said, "and to the ones who made it back." The city moved around them, indifferent and endless. They didn't move. Not yet. They had time now. If this story moved you, share it with someone who needs to hear it today. Our veterans carried the weight of this country, and too many of them are still carrying it alone. Hit the like button, subscribe, and turn on notifications, so you never miss a story of courage, sacrifice, and the bonds that nothing, not time, not distance, not even a classified casualty list, can ever truly break. Tell me in the comments, did you see the twist coming? And what do you think she wrote on that page? Until next time, never leave anyone behind.